So my patient has been running a bit of a temperature for the last few days due to a wound infection. The nurses have been checking her vitals, blood pressure, temp, pulse, respiration every 4 hours, and it's about time for another reading.
Good. Do you have the right equipment?
Well, let's see. In order to check her vitals, I'm going to need my electronic thermometer, and probe covers, blood pressure cuff.
Very good.
A watch, and a stethoscope. So yeah, I think I'm all set.
I think so too.
Good morning, Mrs. Lewis. I'm Melissa King. I'm a nursing student, and this is my instructor, Miss Scott.
Mrs. Lewis.
How are you feeling today?
Oh, not bad. I'm just feeling a little clammy, though.
Yeah, okay, well, we'll see if that fever's broken. We're going to be taking your temperature, pulse, and blood pressure. That okay with you?
Fine with me.
Okay. I'm going to close the door to give us some privacy.
Okay.
A little hand hygiene. Right. So I'm going to check your ID bracelet real quick. Okay.
Good. So the first thing you're going to do is check Mrs. Lewis's chart just to see how often the temperature, pulse, and respirations are taken.
All right.
Good.
It says here they should be at 4-hour intervals.
Okay. Oh, so that's roundabout now. Okay. Now, sometimes nurses make the decision to check the vital signs more frequently. It depends on the patient's condition.
Okay.
Okay.
Well, should I wear gloves?
Oh, now, see, that's a very good question, Melissa. You need to wear gloves when there's a possibility of coming in contact with blood or bodily fluids, or if the patient has excessive secretions coming from the mouth, or if contact precautions are being observed. But in Mrs. Lewis's case, gloves aren't necessary.
So I'll just check the thermometer, make sure that it's working properly.
Good, good.
I take it out of its pocket.
Good.
I put it in the probe covers till it snaps. And then I place the thermometer under Mrs. Lewis's tongue in the posterior sublingual pocket.
Very good, yes.
Okay, Miss Lewis, if you don't mind me, just, raise your tongue a little bit. How's that? All right, close down on it. Okay. I'll wait a couple seconds. Okay, all done. You can open up now.
Good. Now be sure to dispose your probe cover, and then you'll want to record your reading on Mrs. Lewis's chart.
Right.
Okay.
So it's 97.3.
Good. 97.3, Mrs. Lewis. Very good.
All right, so we're going to move on to pulse now, if you don't mind.
Fine.
You can take your wrist here, and with my first, second, and third fingers, place it on the radial artery, and then with my thumb against the back of the wrist, up against the radius bone.
Right.
Just enough pressure to feel the pulse in the artery. Then with my watch, I'm going to count the number of pulsations within a 30-second period,
That's right.
noting the rhythm and the strength of the pulsations.
Right. Then you multiply the number of pulsations times 2 to get the per minute pulse rate. However, if the pulse is abnormal in any way, you'll want to count for a minute. Okay? All right, let's get started.
Okay. Very good.
Very good, Melissa. I noticed you went right from counting the pulse to observing the rise and the fall of her chest. You remembered. And there again, you count for 30 seconds and multiply by 2 to determine breaths per minute. And if her respirations are abnormal in any way, you want to take them for the full minute. You have to remember that. That's very important. You want to chart that down.
There it is.
Very good. Good. Okay.
Okay, Mrs. Lewis, now we're going to move on to blood pressure.
All right.
Now, we take a patient's blood pressure only after they've rested for at least 5 minutes. And you also want to make sure that the patient hasn't smoked or had any caffeine for at least 30 minutes.
Mrs. Lewis, have you had any cigarettes or coffee in the last half hour?
No, just a little juice and some oatmeal.
Oh, good, good. Now, in this case, we can measure using either arm. If there were a dialysis catheter or any venous access devices like a PICC line or an implantable port or an intravenous access, we'll have to use another limb.
Okay, I read that you shouldn't take blood pressure where there's a surgical site or on the same side as a mastectomy.
That's right, that's right.
Okay, so I'm going to clean my stethoscope with the alcohol swabs and we can begin soon.
Okay, and while you're doing that, I'm going to help Miss Lewis get comfortable. Okay, good. There.
Okay, Miss Lewis. So I'm going to take your arm, raise it at heart level, palm up so I can locate the brachial artery. I'm going to undo this for a minute so I can expose your upper arm here. And then with my first, second, third finger, palpate to find brachial pulse.
Yes.
Which is right there.
Okay, you
All
got
right,
it?
yeah. Now, blood pressure cuff.
Okay,
I'll
now line it up
the,
right.
yeah,
Yes,
line up
make
the
sure
bladder
it's
right.
lined up. Good.
The artery.
Good. Good. The lower edge of the cuff should be about 1 or 2 inches above the inner aspect of the elbow, and the tubing should extend from the edge of the cuff near the patient's elbow.
Right.
Now, tell me, what's your next step?
Okay, well, I'll check to make sure the cuff is snug around the upper arm. And then I'll look and see that the gauge is at 0. I'm going to estimate her systolic pressure first. So I'll find the brachial or radial pulse and then tighten the screw valve on the bulb.
Okay, right. Now, use the bulb to inflate the cuff as you palpate the artery.
Okay.
All right, now take note of the reading when you can't feel the pulse anymore. This is the estimate of her systolic pressure.
Yeah, I couldn't feel it after 128.
Oh, okay, good. Now deflate the cuff and wait about 15 seconds. Okay, good. Now palpate the brachial pulse and place the bell or the diaphragm of the stethoscope firmly over the artery. Now make sure that it's not touching the cuff or her gown.
Okay.
Just like that. Good. Now you can go ahead and inflate to about 30 millimeters above where the pulse disappeared when you palpate it. Okay, wonderful. Now slowly open the valve on the bulb and let the air out about 2 to 3 millimeters of pressure per heartbeat. When you hear the first sound, that's your systolic pressure.
I hear it.
Good. Keep deflating until the sound becomes muffled. And then continue to deflate until the sound disappears. Now, you might hear them together or separately, but once the sound disappears, that's the point of a diastolic pressure.
It's gone.
Okay, what did you get?
126/68?
Good. Now let's go ahead and completely deflate the cuff, and be sure to document your measurements according to the policy. Now, you do know how it should appear on the chart, don't you? Okay.
It should read 126/68.
Good, yes, yeah.
126/68.
Now, if you've taken a blood pressure other than the brachial site, be sure you mark on the chart exactly what site you use.
Okay.
All right? And be sure to report any abnormal findings to the patient's primary care provider.